Good morning. I would like to introduce Dr. Jennifer Picarsic, who is a member of the Division of Pathology. Dr. Picarsic is the co-director of the Langhorne Cell Histiocytosis Center. Her presentation today will be about pathology and clinical laboratory medicine. Dr. Picarsic?
All right, thank you for that nice introduction. So we'll get started. All right, so what is pathology and clinical lab medicine? Many people, even in medicine, know that you can have tissue and blood, and we produce results for the patient and family and doctor to review. But what really happens, and a lot of people think it's just a black box, but all of these different terms and pictures are related to pathology and clinical lab medicine. So who are we? We are the team in medicine that helps name and classify diseases by examining tissues, blood and fluid, and even whole bodies at times during an autopsy. And we also ensure the quality and accuracy of these testing results. So what are the different jobs that can be found in pathology and lab medicine? There's so many, but here's a listing of just a few of them. I'm one of the pathology doctors, so I've graduated high school, I've gone to college, I went to medical school, and then I did another 4-year residency program. So it's been a lot of training, but it's definitely been worth it. We have lab directors who are pathologists. Some of our scientists that have their PhDs are also lab directors. We have pathology assistants who help us, and I'll show you some of the tasks that they do later. And they go to college also and do a 2-year specialty schooling in pathology assistant school. We have histotechnologists and other lab technologists that will go on to do certification exams past their college training. We have many different other very cool jobs also in the field. We also have different areas. So just when you say pathology or the lab, there's so many different aspects. We have a surgical anatomic pathology that mainly deals with tissue. We have a clinical pathology side that is mainly looking at tests within fluids such as blood. And then we have molecular pathology that can span either of these, but a lot of our COVID testing has been done, for example, through our pathology labs, looking at DNA and the building blocks. This is just a small sampling of some of our faculty members, but we have hundreds of other allied health professionals that help us create the results from our tissue and blood samples. So, for example, what happens when you get a blood test and the blood is drawn? You get a result of what your hemoglobin or other lab tests may be, but what happens to that blood? So here at Cincinnati Children's, our clinical lab has hundreds of different lab tests that doctors can order. And what's so neat is that, say you're in one of the areas of the hospital, either an inpatient or outpatient facility, and a nurse draws blood. Where does that get sent? Well, we have this very sophisticated pneumatic tube system throughout the hospital that will shuttle that in these little canisters that almost look like a bank teller's specimen, and they'll come out, and each of those test tubes have a specialized barcode that will tell us the patient, the testing that gets ordered, and there's a very sophisticated sort of, it's called the Toyota, based on the Toyota Lean system. It's part of effectively maximizing quality and value and reducing waste. So that all gets tracked very efficiently. We have color coding systems. We have TV monitors that keep track of the specimen all through this barcode. We have people reading slides, such as like on a for looking at a blood analysis. We have a lot of robotic type machines that the specimen gets put in and the barcode reads it, and it gets shot through magnetic strips that send it around and aliquot, specifically what type of sample is to be read in the test. We have large computer screens to analyze drugs and metabolites in our mass spec lab. We have refrigerators that hold our blood specimens before they get sent to the OR. And all of this is done by our pathology and lab professionals to ensure quality and accuracy in the testing result. Now, what happens if you or a patient has a lump or a disease that needs to be removed? Where does that tissue go? Well, after one of the doctors or surgeons would remove that diseased little part of an organ or take a little snippet biopsy of it, that gets sent to our anatomic or surgical pathology lab. And again, a sort of black box, tissue goes in, results come out. So what happens in the surgical pathology lab? Well, similar to the clinical pathology lab, there's a place where we call accessioning, where that tissue gets a specialty barcode, it gets entered into our computer system and gets sort of triaged as to where it goes. And then our pathology assistants will take that and characterize the tissue, and we'll go over some aspects of that. And then our histotechnologists sit in the back and will process that tissue and make it into a slide. So one of the most important things is what we call these little cassettes, which I'll show you later. And the tissue, it's sort of the transporter of the tissue through all the different steps, from the sort of what we call the gross macroscopic image into making a slide until the pathologist reads it on their microscope. So here's our pathology assistants, and they're at what we call the grossing benches, tables, and some of the pictures that are coming up next may look gross to you, but this isn't supposed to be an icky gross. This is a macroscopic description of the tissue. So we could get small little needle cores looking at if things tumor, or is this a mass lesion or not? Is this, it could be from a transplant patient looking to see if the body is rejecting the specimen. We could get whole organs. This is an appendix from someone that had an appendicitis. We get tonsils that are removed. We get sometimes a whole organ if there's a disease or mass lesion, such as a cancer. So this is the normal kidney that filters the blood and urine. And this is an area of disease. So this isn't helping the patient at all and needs to be removed. And so our pathology assistants will characterize and measure and weigh and describe all of these with the pathologist assistants, and then put it into small little pieces. So they use different instruments as a scalpel blade that they cut up parts of the tissue so that we can characterize it on glass slides. So the first process is putting it into these cassettes in smaller pieces. And then what happens next is through a series of different steps in a processing machine, that small amount of tissue will get fixed and dehydrated, and then a thin coat of wax over it. And then the next day, the histotechnologist will take a metal rack of all these cassettes out and put it in his or her workstation. And then what they do, and in this example, it's a very, very tiny piece of tissue, but sometimes it'll be a larger piece of tissue. They'll put it into the metal mold or cast with hot wax and position it correctly in the mold and get it set just perfectly. And then they take this same block that went with the patient that has their unique barcode ID information and put that same little plastic cassette with the tissue. And then what happens when you have hot wax and put it on ice, it will solidify and get hard. And then that is made into a tissue block such as this. So what we do is we pop it out of the block and we melt it down so that the sides are nice and clean. And then what we do is we take this block over to our next workstation, the histotechnologist workstation, and they'll cut the tissue on these microtomes. So let's see how that works. So we take that same block, here's the tissue in that wax, what we call paraffin block, and there's a very sharp razor blade right here, and that cuts the tissue into very, very thin sections. And as we're cutting the block up and down with the wheel here, the tissue, you can see it's sort of a little lumpy, bumpy, but we lay it here on a water bath that flattens out the tissue. And then what we do next is in that water bath, the histotechnologist will take a glass slide and pick up a single piece of very, very thin tissue. So that's the tissue in the little wax that he's picking up and putting on a slide. And then on a clinical specimen, those slides will also have a barcode so that we can track it. But what happens, we can't look at tissue that hasn't been stained. So what we do next is we take all of those glass slides, put it in a tray, a little rack, slide rack here, and then we have another robotic machine. This robotic arm will come over and at interval timings will stain the tissue. This is our main hematoxylin and eosin H&E stainer. We have many different stainers that look at different aspects of the tissue. So we have immunohistochemical stains, we have special stains that will detect collagen, fibrosis, different bug stains to look at in the tissue. So we have many different colors in pathology that we can look at on the glass slide. And then the pathologist will take the glass slide and look at it under the microscope. We have normal microscopes with light, LED, halogen lights. We have microscopes with immunofluorescence to look at it. And we move it around on our stage. We have different objectives that can zoom out and in looking at the tissue. And what's really cool here and at other pathology labs is that we also have the ability to take those glass slides, put them in another rack after they've been stained, and put them in a digital scanner. And this digital scanner is so cool because what it does is it'll take the glass slide and it is making a digitized image of our glass slide. And why would that be important? Well, because then you don't always have to have a microscope. So I could review slides basically anywhere in the world from a microscope, from a computer screen rather than a microscope. And as you can see, we can zoom in and out just like a microscope can. Now, of course, we have to ensure the quality and accuracy in all of our testing results by doing a lot of validation, making sure that the microscope and digital images are the same. But this is the future of pathology. So as I like to say, pathology in lab medicine is so cool because we get to see disease and the different aspects right in front of our faces with lots of different colors. So this is just a listing of some different resources that you might find helpful on the internet about what is pathology, some of the different allied health career websites in lab medicine and pathology, and different content about education requirements and certification. This is my email and little Twitter handle that I post some pathology related aspects. And as you can see here, this is one of the students from the biomedical research internship for minority students. And even as in research settings, you can use the principles of pathology, cutting sort of tissue sections. So we have many different aspects in our pathology labs. So thank you all.
So we have a couple questions. So the first question, Dr. Picarsic posted in the chat. How did you decide to become a pathologist?
Well, it's very interesting because I actually thought I was going to go into internal medicine and be a doctor. And when I was in medical school, I started getting frustrated with not being able to see always the disease up front and personal. And I started at times in medical school following the specimen. So I would follow the lab blood, or if I was in the operating room, I'd ask if I could go out and see where the tissue went. And once I started doing that, I realized this is a really cool career that you can make. And as a doctor, I was able to help other doctors sort of understand their disease. So I think it happened in medical school when I just started following, where does that tissue, where is that black box, and who's taking care of that tissue?
Awesome. One other question that I have for you. What is some advice that you would give to any young person? So the people who will be viewing this could be in middle school, like 7th and 8th grade, but there also could be some high schoolers viewing this video. What's some advice you would like to give them if they're considering pursuing a career in pathology or any other STEM field for that matter?
I think now, even more so, there's so many internet resources to explore, but I think it's important to sort of seek out individuals in your local community that through systems like this to just meet with a person. And we're always, no matter how busy we are, we love being able to show people around. And I know with COVID, it can be difficult, but I would say trying to find a person to talk about the more details is always helpful. But, in the interim, there's a lot of different resources about what we do. And I think it's just important to keep an open mind because you never know what you're going to do. And I think the most important thing is not closing a door, keeping all your doors slightly open and just working hard in the current schooling that you're at. And just that will enable you to keep your doors open and opportunities open.
Well, thank you so much, Dr. Picarsic. This was an amazing presentation. Thank you so much.
Okay, good luck.
Thanks. Bye.
Bye.
Good afternoon. Next, we have Miss Suzanne Summer. Miss Summer is a registered dietitian and is also a clinical research manager in the Schubert Research Center. The title of Miss Summer's presentation is Everybody Eats, Nutrition Science and the Registered Dietitian.
Okay, thank you. First, I want to share with you what is registered dietitian, or RD. An RD is an expert in food and nutrition. Dietitians educate people on healthy eating to prevent disease, and we provide nutrition therapy for ill and hospitalized patients, such as people undergoing trauma or surgery, who have illnesses like cancer and heart disease and diabetes, and many more, including dietitians do treat a lot of patients who come to the hospital with COVID-19. To become a registered dietitian, there are two main education paths that you can take. One is to obtain a 4-year college degree from an approved dietetics program, and we have these programs at University of Cincinnati, Miami, University of Dayton, and many other schools across Ohio and across the country. The other option is if you already have a college degree, you can complete additional courses to be able to be eligible to become a dietitian. Starting in a few years, dietitians will all have to obtain a master's degree, so that's another 1 to 2 years of college on top of the 4-year degree. After your education, you complete a clinical internship at an accredited hospital or other organization, and then finally you have to take a test. You have to pass a test for certification and licensure. Our national organization's website has a great name. It's eatright.org, and you can find out all of this information there. In addition to the education and training, there are certain skills that are very desirable if you want to be a dietitian. One is you should be a very good communicator with people of all ages and backgrounds so that you can understand them and do the best job to help them. Cultural awareness about food and diet practices is very important. Not everybody eats like you do. People eat differently for religious reasons, cultural reasons, and just through family habits. So you have to understand when you're counseling someone that they might eat differently. You do have to be comfortable with hands-on practices, and that means touching people. You might be touching their arms or their waist or touching their head. and definitely touching their skin, and that's our physical assessment, and you need to be okay with doing that. You should have empathy for people who have chronic conditions, such as being overweight or having eating disorders or diabetes. Empathy, I'm sure you know this, means putting yourself in someone else's shoes. So being able to do that can really help you to take care of your patients or your clients. You should have a desire to work with individuals to teach them and support them to make changes in their lifestyle and their diet. And then, of course, you should always stay informed about the newest diets, food trends, and nutrition science news. As a dietitian, you can work in a traditional setting, like a hospital or a clinic, and in food service and nursing homes. There's also non-traditional places that dietitians can work, such as a fitness center. You can be a food writer or a blogger or a wellness coach. Some dietitians even have their own private practice, like a doctor's office, where clients come to see them to talk about their diet. I'll tell you a little bit about my career path. I'd be considered more of a non-traditional dietitian because I work in research. I'm also considered non-traditional because I had a first career in business, and when I was in my late 20s, I decided to go back to college to become a dietitian. I'm going to tell you a little bit about what it's like to be a research dietitian at Cincinnati Children's Hospital. My team and I get to do all kinds of fun and interesting things to collect data for human research studies. We get to measure people's height and weight, measure body parts like their arms, their waists, and even their heads. And these measurements tell you a lot about someone's growth and the composition of their bodies, including body fat, muscle, and bone. We can even measure your skeleton. Another thing that we do as a research dietitian is we operate a metabolic research kitchen. Here, we do things like teach cooking classes. We prepare foods for research studies where they need a very specific meal composition. And we also prepare foods to give to patients who have food allergies to see how they might react to those. That's just a little bit about what I do, but as I mentioned before, dietitians do all kinds of different jobs in different places. And so I asked a few of my friends to say some words about what they do. So please enjoy this video.
Hi, everybody. Bridget Wojak, registered dietitian. I act as the director of nutrition at Kroger. My job is to help people find easy, affordable ways to eat delicious, better for you foods. And I have a team of dietitians that work for me to help make this possible at Kroger every day. The reason that I love my job is because I get to help people live healthier lives in a way that still allows them to be foodies and enjoy what they eat.
Hi, I'm Hannah, and I am a registered and licensed dietitian. I work at TriHealth Hospital Networks as an inpatient dietitian, outpatient dietitian, and I also teach a diabetes self-management education class in addition to a pulmonary rehab class and the nutrition guidelines. So I am so excited to share with you my dynamic role, and I hope this inspires you as a dietetic professional.
Hi, I'm Jason Roberts. I'm a registered dietitian at the Cincinnati VA Medical Center, where we do the important work of taking care of our nation's military veterans. As a dietitian at the VA, I help veterans improve their nutrition and their overall well-being. What I love about being a dietitian at the VA Medical Center is seeing all the positive changes my veterans make to improve their life.
Hi, my name is Megan McNeil. I'm a dietitian who works in research at Cincinnati Children's. In my role, I help coordinate several different nutrition-focused studies. I help create protocols. I enroll participants and collect data, and then I help make sure the data is clean so that investigators can use the data for their research analysis. What I love most about my job is getting to help the pediatric population and then the variety of learning I get to experience as I work on different studies.
My name is Jessica Ernst, and I'm a registered dietitian at Cincinnati Children's Hospital. I specialize in neurology and working with children who have pediatric epilepsy using the ketogenic diet. The thing that I love the best about my job is helping heal children by using food as medicine.
Hi, I'm Carolyn Peterman, and I'm a dietitian at Figure Weight Loss. There I advise patients kind of on how to eat, change their lifestyle, really focusing on what their current lifestyle is and how to make positive changes towards a healthier lifestyle to better reach their health-related goal, whether that be weight loss or controlling their blood sugar. What I love most about my job is being able to follow up with the patients and see those small progresses, them getting closer to their weight loss or other health-related goal.
Hello, my name is Robin Phillips. I'm a registered dietitian. I started my career as a dietetic tech from Cuyahoga Community College. I then went on to the University of Cincinnati to earn my bachelor's degree in dietetics. And for my master's degree, I did an advanced degree with qualifying work experience in order to sit for the RD exam. My career is mainly in community nutrition and school food services.
Hi, my name is Ashley Moiser, and I'm the registered dietitian for the Cincinnati Reds. During the season, I get to plan all of the meals, snacks, hydration initiatives for the players and the staff. Throughout the off-season, I get to work with them to fine-tune any of their nutrition, set menus, meal plans, grocery lists. What I love about working with the athletes is just being with them one-on-one, developing relationships with them, and then also seeing the motivation that they have to make changes. So they'll do whatever they can to become a better athlete, and as long as I provide proper education, they're really motivated. So it's a fun profession, and I love doing what I do.
So those are just a few different jobs you can have as a dietitian. For my first poll question, I'm going to hand it over to Erica. If you were a dietitian, which job do you think you would like the most? Great. It looks like sports team dietitian and collecting data for research are popular, and coaching people. And now it's time to introduce a little science into the presentation. Let's talk about one of my favorite nutrition topics, antioxidants. Antioxidants are nutrients in foods that protect your cells from damage from free radicals. Free radicals are unstable molecules that can damage your cells in your body. Your body creates them when you digest food or breathe in pollution. Smoking also produces free radicals in your body. This cell damage can increase your risk of cancer, heart disease, cataracts, diabetes, and infection. And free radicals could also affect your brain function. But by consuming foods that are high in antioxidants, you can fight these damaging effects to maintain and improve your body's health and function. These are some examples of the antioxidants that are found in foods. Fresh fruits and vegetables are the best sources of antioxidant nutrients, and eating a wide variety of foods will help you get the full benefits of all of these antioxidants to help fight disease and keep your body healthy. Here's my second poll question. What do you think is the major antioxidant found in oranges? It looks like everyone agrees, vitamin C, and that's correct. Okay, now I'd like you to watch my science experiment. Hello, I'm Suzanne Sommer, research dietitian for the Schubert Research Clinic at Cincinnati Children's. Welcome to our antioxidant nutrition scientific experiment. Before I start, I have to credit my colleagues at Miami University in the We Engage for Health project for sharing this experiment with me. This experiment will demonstrate how antioxidants combine with and destroy harmful oxidants in our bodies to improve our health and help us fight off disease and live well. Here we have a solution containing an iodine compound and water. Iodine gives it the light brown color that you see, and this particular iodine compound acts as an oxidant. In our experiment, we'll add small droplets of different foods to the solution. If the food contains antioxidants, it will make the brown color turn clear because it's deactivating the harmful oxidant, just like it does in your body. The more antioxidant the food has, the less it will take to make the solution turn clear. Here are the foods we're going to test in our experiment. A fresh orange, orange-flavored vitamin water, and orange soda. I'll bet you have some guesses as to which foods are going to work best. I prepared the samples ahead of time. For the orange, since I used a whole fruit, I had to cut up the orange and squeeze the juice out so that I can draw some up in a pipette. And here's the liquid from the fresh orange. So let's start with the fresh orange. Now count the number of drops with me, and we'll see when the solution turns clear. So for each drop, I count the drop and I swirl it to see if the color changes. Oops. 1, 2, 3. It's getting a little lighter, but it's still brown. 4, 5, 6, 7. Can you see the difference? This one's clear now. 7 drops. Next, let's see what happens with the orange vitamin water. Again, count the number of drops with me. Ready? 1, 2, 3, 4, 5, it's getting lighter, 6, pretty close. Let's say 6 for that one. Great. And finally, let's try the orange soda. Now again, count the number of drops until the solution turns clear. Oops. 1, 2, 3, 4, 5, 6. Okay, still no change in the color. I'll go a little faster. 7, 8, 9. Oops. Still no change. 10, 11, 12, 13. Still no change. 14, 15, 16, 17, oh boy, 18, 19, 20. Okay, I think I'm going to stop here because we're not getting anything, and clearly there's not any antioxidant in the orange soda. And that's our experiment. Next, we'll discuss the results. Okay, here's our next polling question. Which item contained the most antioxidants? The orange, the vitamin water, the orange soda, or both orange and vitamin water? Okay, so the answer is A and B, because the fresh orange took 6 drops and the vitamin water, or 7 drops, and the vitamin water took 6 drops. So they're pretty much the same. So why did the orange soda not perform well as an antioxidant? Well, of course, because it's just orange flavored drink and there's not any real orange in it. But if that's true, then why do you think the vitamin water does as well as a fresh orange? It's also an orange flavored drink, and vitamin water doesn't have any orange in it. But of course, vitamin water is a processed beverage that has lots of vitamins artificially added to it. I've also done this experiment with orange juice, but I didn't show you that today. And guess what? Orange juice also takes only about 6 drops. That's because orange juice also contains vitamin C, just like oranges and vitamin water. However, there are a lot of good reasons to choose a fresh orange over these beverages. One is that vitamin water costs about $1.50 to $2 a bottle, and an orange about 60 cents, so you get a lot more bang for your buck with a fresh orange. Second, oranges have more than just vitamin C. Oranges are packed with good-for-you fiber and other nutrients that you don't find in vitamin water or orange juice. And third, many of these processed beverages, even orange juice, can have a lot of added sugar and extra calories that you don't get from eating a fresh orange. Okay, and this is my last question. Why is whole fruit the best choice? Because it contains fiber and nutrients, because it's more affordable, or because it's lower in sugar and calories? I think you all got it right. It's all of the above. Okay, thank you everyone for listening today. That's the end of my presentation, but I'll be happy to answer questions.
So we have a couple questions. Oh, Dr. Picarsic, what made you decide to change careers to become a dietitian?
That's an easy question for me to answer. I mentioned before I was in my late 20s, so I was a young adult, and I think around that time is when a lot of people start to think about their own health, because you realize, you know, I'm becoming more of an adult and I have responsibilities and I need to take care of myself. And I personally started reading a lot of books about nutrition and how to eat well. And I found one book that was written by a person who had these letters RD after her name. And I was so interested and really compelled when I read this that I went and looked up what's an RD, and I looked up how to become one. And then I applied to the program at University of Cincinnati and went from there.
So I have a question.
Mm-hmm.
What is one of the coolest experiences that you've ever had as a part of your career as a registered dietitian?
Oh, so many. I'll have to say that I'm not sure if this will mean a lot to a lot of the audience, but in research and here at Children's, we know a lot about the National Institutes of Health. And actually, I'm sure with COVID-19, a lot of people out there have heard about the NIH, or National Institutes of Health, even if you'd never heard of it before. And that's our country's national research facility. When I was in my dietetics program is when I got involved in research early on and thought, I wonder if I can make a career in research as a dietitian. And they had that clinical internship at the National Institutes of Health. And so I applied for that internship, and I had the wonderful experience of moving to Washington, D.C. for a year and doing my dietitian internship at the National Institutes of Health. And that really set me off on the research career that I wanted. And I'm so happy I got to do that.
That's awesome. And then I have one last question.
Okay.
What is some advice that you would give to a young person who might be viewing this video, who's thinking about maybe pursuing a career as a registered dietitian or even in another STEM field? What's some advice that you would give them at this point in time?
So I think, as you get into high school and closer to college age, I think that it's really important to do your research and know, first of all, what you're interested in and what you want to get into, but maybe at that age, more importantly, to go to those websites and find out what does it take to get there. So find out how much college you have to do, find out where you can do it, and, is there an exam? How many years is it going to take? I think those things are important, and always, but now more than ever, it's really important to get some experience through volunteering.
Well, thank you so much, Ms. Summer. That was a great presentation. You're always great every year. We miss seeing you in person this year, but maybe next year, we'll see. Thank you so much for joining us.
Thank you. Thanks for having me.
Bye.
Uh-huh.
Good afternoon. I would like to introduce next Ms. Kelly Dixon. Ms. Dixon is a certified athletic trainer in the Division of Sports Medicine at Cincinnati Children's. Her presentation will be about the career in athletic training. Ms. Dixon?
Hello, guys. As she said, my name is Ms. Kelly Dixon. I am an athletic trainer at Children's Hospital in the Division of Sports Medicine. I've been an athletic trainer now for 10 years, and within those 10 years, I have actually been all at Wither High School as well as DePaul Cristo Rey, which I'll share a little bit more as we continue. So this is my first poll question. Do any of you currently play sports? Yes, no, you like to watch them in person versus in general? All right, so it looks like I've got some of you that are currently playing who like sports but aren't currently playing them right now, and then some of you that aren't really big fans of them. But I'm hoping that as we continue these videos that people really start liking sports and maybe they get into them a little bit later. So then my next question for all of you is, have you ever been injured or hurt playing a sport? Yes, no, not really sure. Some of you have been injured in sports, some of you not so much, and you've been the lucky few. But so my career and my job as an athletic trainer is to really help those athletes that are in sports, but not just those that are in sports. But so I deal with a whole wide realm of individuals. An athletic trainer technically is a highly qualified, multi-skilled healthcare professional who works in collaboration with a lot of other healthcare team members. So the presenter before me was Ms. Summers. Ms. Summers, she is a dietitian, and that's someone that would be on that healthcare team. We also work with physicians, we work with physical therapists, I would even consider my coaching staff, the parents, as part of my healthcare sports medicine team, because our goal is to get athletes back out onto the field or to stay onto the field as long as possible, to be able to do exactly what they enjoy doing, playing sports and engaging in exercise. So the field of athletic training encompasses a lot of different things. So we deal with prevention, examination, diagnosis, treatment, rehabilitation of emergent, acute. So acute is like something that just happened, or chronic injuries, which are those injuries that came about because of usually overuse injuries, something that has been going on for a long time and really got worse as it continued. So me personally, I was a high school athlete. I played basketball, ran cross country, was a track athlete, tried to do pole vault, which was a lot of fun. I also was a statistician on our football team. I swam, I played softball. I tried to do just about every single sport that there is. And then when I got to college, I decided that I was going to be on the rowing team, which was a great experience for myself. But at the same time was very difficult when I was trying to be a rower as well as a student athletic trainer. At the University of Cincinnati, as a Division I college, you had to do, for a Division I athlete, you are in practices a lot. And so as an athletic training student, I was doing my own practices as an athlete and then somebody else's practices later on in the afternoon as an athletic training student and engaging in that realm as well. So I got to see both sides of the field. So that was a little bit difficult trying to do both, but it is possible, as I was able to do it. But again, it's difficult, and we can continue on with that. Currently, so after I graduated from the University of Cincinnati, I was looking for jobs, and I was fortunate to find one at Wither High School. So I've been at Wither High School for 10 years now. I started at Cincinnati Children's about 7 years ago. For the first 3 years at Wither, I was working with a team physician in the sports medicine department at Children's, and we were able to come up with an outreach program to be able to serve all of the Cincinnati public schools, not just Withrow. And so we were able to create that program, which I am fortunate enough to be able to help out with and work with. And so we serve all of the, well, majority of the Cincinnati public schools, as well as some other schools such as like North College Hill, St. Bernard, DePaul Cristo Rey, and there's a few others. So we serve a wide variety of athletes in the Cincinnati area. Like I said, I also work at DePaul Cristo Rey, which I started there about 7 years ago. They are a very small school, but they still have athletes that need to be served with an athletic trainer, a good healthcare provider. When I was in college, I know that I didn't really know exactly what I wanted to do. I'm sorry, I know I'm backtracking a little bit, but I started out at University of Cincinnati thinking that I was going to be a surgeon, orthopedic surgeon. I was dead set on it. I started out with my major being biology, and then I did not enjoy my biology class, and so I really had to change my pathway very quickly. And because I had always been in sports, I decided that athletic training was probably the best career for me. When I was looking in high school at colleges, I looked at the University of Cincinnati and hoping that they had an athletic training program, but I didn't see one. Turned out that they did have one. It was just an emphasis for a degree instead of an actual degree at that time. My graduating class at UC was the first class to be able to graduate with a bachelor's degree in athletic training. So that was very fortunate of me to be able to be in that program. But it wasn't something that I was able to find right away when looking, and a lot of college counselors actually did not realize that UC had an athletic training program when I had asked about it at the different college fairs. And so, like I said, it was an emphasis. My degree started out as health promotion and education with an emphasis in athletic training. And then, so I was able to take all of my classes, my athletic training classes, and they were able to change that degree into an actual major instead of just an emphasis. So that was very fortunate of me. And then I was able to find this job at Withrow, which was a needle in the haystack kind of thing. I applied at multiple different clinics, and I was told I needed a little bit more experience, which was frustrating at the time because I was like, how do I get more experience if you don't hire me? But so then I was able to find the job at Withrow. I was part-time to start with. My head athletic trainer at the time was Miss Anita Beauchamp, and she was a health teacher at the school as well as the athletic trainer. And so she needed a little bit more help trying to get all the practices covered, games covered, that kind of thing. And so I got the job immediately, which was scary at the time, but great in the end. And then I got to transition over as the head athletic trainer when she started her own family and wanted a little bit more time at home instead of being a health teacher as well as the athletic trainer, as well as raising her child. So I took over and was able to continue on the program. We at Withrow had a high school sports medicine club in which I was trying to help train a lot of other high school students, the profession of athletic training. So they kind of helped me out at some of the games. They did a lot of first aid stuff. They helped me with some of the taping techniques that I would show them. And then it got a little hectic for me because I then became a clinical instructor over at Mount St. Joe as well as Thomas More. And so then I started bringing in some college students that needed their classes. While at the University of Cincinnati, I had to take a lot of hours of clinical instruction. So those hours would be out with the football team, with the soccer team. You do a rotation with your team physician. So you're learning a little bit more about general med and like what kind of medication dosage some athletes would need for different injuries and different illnesses that they might have. We did a rotation with our physical therapists so that we learned a little bit more on the rehabilitation side. And then we also had to do high school as well as college rotation so that we were able to see what it was like out at the high school versus what it would be like in the university setting. And then we also had to end our college time with an internship. And so I was fortunate enough to actually do my internship down at ESPN's Wide World of Sports, which at the time was called Disney's Wide World of Sports, but I had transitioned while I was there. And at ESPN's Wide World of Sports, we got to see every single sport known to man. We even got to see the Braves come in and do their spring training down there. We would help work spring training for various baseball and softball programs throughout the country. We worked rugby games, we worked gymnastics competitions, cheerleading competitions, field hockey, you name it, we made sure that we covered it. And so I got a really great experience going down there and was very fortunate enough to be able to see a wide variety of injuries that for the first time that it was my injury to take care of instead of somebody else's that I was helping with. And then here I've got a short little video kind of explaining my competitive spirit coming into athletic training.
I was a young athlete growing up and really enjoyed competing, and I wanted to keep that drive going throughout my career. My name is Kelly Camp, and I'm an athletic trainer at Cincinnati Children's. Our athletic trainers have a consistent presence at all of our high schools. We are there to physically get them ready for competition, but we are there for mental stability as well and support. And I feel like most of our athletes really get that from all of our athletic trainers at Children's. We are trained and educated on just about every single musculoskeletal injury that they can go through. So we are able to take them through every rehab process, and we have the resources to get information from our physical therapists, from our doctors at Children's, and apply that back in the athletic training room. Our doctors and our athletic trainers work very well together at our high schools, and it's that combined caring manner that we have that really makes a difference between Children's and some of the others in the area. Success for an athletic trainer is seeing an athlete get hurt and be able to come back up and excel past what they were before. Cincinnati Children's is an elite hospital. Having that support is phenomenal.
So that's just a brief overview of that. And then future possibilities. So athletic trainers are not just at colleges, universities, high schools, or even in the professional setting. So there are athletic trainers in the professional setting. Majority of you know athletic trainers only because they've seen them run out onto the football field in the middle of an NFL game because some guy went down. Yes, that is a majority of what people think of an athletic trainer, but we're also in a military setting. We can become a brace rep. And so when somebody has surgery and they need a specific brace placed on their body to try and help them get back into sport, we can be that person that helps fit those. Athletic trainers are even in the industrial setting. So this far picture is an athletic trainer working with a factory worker and trying to get back into their profession. So even you might not consider the UPS driver and delivery guy as an athlete, but they are doing a lot of physical work within their job, and that's required in their job. And so if they get injured because they lifted a package that was too heavy and they hurt their back, an athletic trainer can help get them back into that job and be able to help work on prevention, even from hopefully allowing us to get those athletes or those workers from being able to prevent that injury from actually occurring. So doing something like a fitness program even at the UPS factory so that we can try and get them to be able to prevent injuries from occurring. But the military setting is a huge one that's been booming actually in the recent years. They're bringing athletic trainers in to try and help educate a little bit more the military personnel on their bodies and how to treat them better, and being able to work through some of their injuries to be able to get them back out into the field and be able to be deployable so that they can help fight for our freedom in our country. So like I said at the very beginning, athletic training is a lot of different aspects, but prevention is a big one. So we do emergency action plans. We try and help strengthen muscles to try and prevent injuries from occurring. We help with the hydration side, making sure that athletes are well nourished as well as hydrated so that they can perform at their best. And then in the examination part, we're looking at a history. How did the injury happen? What were they doing? Is this something that was chronic or acute? We're looking at what does the injury look like? So is there swelling around the area, or is there any kind of discoloration? We're palpating, so we're feeling around in the injured area to see if we feel any differences in that injured spot. We're looking at range of motion. Do they have motion, or are they not able to do any kind of motion in that injured joint or body part? And then we also have some special tests that we do to see, so this kid has a knee injury. Are we able to do a Lockman's test to see if his ACL is still intact, or do we do an anterior drawer test to be able to try and look at the stability of that anterior cruciate ligament? We'll also do some functional tests. So if a kid rolls their ankle on the sideline or in the middle of the game, and I have them on the sideline and I'm trying to get them back, all my special tests and my history, my observation, my palpation all looks really good. I need to functionally test that kid before they can go back out onto the field. Are they able to jump? Are they able to run? Are they able to cut? Because if even if my special tests and everything else says that things are fine, if they're not able to run, jump, cut, how are they going to help their team out on the field? So we'll actually do some functional tests as well to make sure that they're able to perform at their best to be able to actually help their team. And then diagnosis. So we also do a lot of concussion diagnoses, as well as helping to, diagnose and treat any kind of injuries. I would say, I don't actually say this is for sure an ACL test. I will say it's most possibly an ACL test or probable, but a physician always has to actually make the final diagnosis on an injury. Treatment, of course, we're doing all of our first aid stuff. So, if anybody's bleeding at all, we're making sure they're, we're able to cover that up, clean up whatever blood that we've got around. We tape ankles, we tape wrists, we tape, whatever body part needs to be taped, or we'll do a wrap or a sling or whatever kind of treatment that we need to be doing, as well as icing an area to try and help reduce some swelling. And then rehabilitation. So we work with a lot of physical therapists to try and get our athletes back onto the field as soon as possible, but we do that. I think that rehabilitation, doing manual muscle testing and manual muscle work is going to help an athlete out in the long term instead of just looking at short term, taping them up and getting them back onto the field. I want to make sure that those muscles are actually supporting everything. As an athletic trainer, we can also work in clinics. So I typically will work as a physician extender at least one day a week. We work with our physicians kind of as like a medical assistant or a nurse. I also do orthotech stuff, so I'll cast and brace athletes in our clinics. So we do basically just everything in the clinic except for that doctor portion. So you might see some athletic trainers in your doctor's offices, especially in the sports medicine offices. Most likely it's going to be an athletic trainer instead of a nurse or a medical assistant helping you out there. And then what do we need to do in order to obtain or keep a degree or certification or a certification in athletic training? So me personally, I was able to do just a bachelor's degree. Within that bachelor's degree, I needed to do over 1,000 hours of clinical experience hours. So those clinical experience hours were with our football team, soccer team, track, high school, collegiate, physician office, things of that sort. But now, actually, the degree has moved into a master's. So in order to sit for your BOC or your Board of Certification exam, you actually need to have a master's degree. I was fortunate enough to be grandfathered in, so I did not need a master's degree in order to sit for my exam, but it is now required in order for you to take that exam. The BOC exam is a standardized test, just like CAT or the GRE or anything of that sort. It is a exam that you need to take in order, and that most of our other healthcare professions have to take actually in order to be licensed and certified. And then each state has their own licensure. Each state is different. Ohio is an ethical exam that you need to take, as well as payment and proof of a degree, as well as proof of passing your BOC exam. And then every 2 years, we have to report some continuing education units. So we need to get at least 50 units every 2 years. So within those, we're talking about making sure that we are staying up to date on all of the new practices within the healthcare industry. So the healthcare industry changes yearly. And so what practices might have been going on while I was in school may have changed. And so I need to stay up to date on all of those. And then I said that I was going to do a week in the life of an athletic trainer, because the day of a life of an athletic trainer changes on a daily basis. So my week normally starts out with meetings and lectures on Mondays. And then I go into the high school around like 2:30 in the afternoon, because I don't need to start until after school gets out, because that's when practices are going on. But then I'll also start another day of the week as a physician extender. My nights can get a little bit long. Practices can go until whenever coaches decide to be done. Games go until they're actually complete. So I'm covering all the games, I'm covering all practices, I'm making sure that while I'm at the school, I'm doing a lot of treatments, I'm doing a lot of rehabs. And then I need to make sure that I'm documenting all of my injuries and my rehabilitation exercises that I've been doing with any of my athletes. And then I make sure that I'm following up with our sports medicine teams, calling parents to make sure that they're up to date on what's going on. So it changes on a daily basis. If you are the kind of kid that does not like to sit still, does not like to just stay in a cubicle kind of area, or wants a change of environment, athletic training might be for you. I oftentimes get told by a parent, oh, it must be so nice to just have a job in which all you're doing is watching kids play sports. And yes, that is very nice, but I'm not just an athletic trainer that sits and watches games. I'm actually there as the medical provider. And I've probably done a whole lot of work right before that game to make sure that those athletes are well prepared to be able to play at their best. So I know that I talked a lot and covered a lot of bases, but is there any questions that you guys have about what an athletic trainer is, or what kind of stuff we do?
So there's a question in the chat. What's the difference between an athletic trainer and a physical therapist?
Good question. So a physical therapist is usually inside of a clinic. A physical therapist also needs to go to school an extra 3 years. So they get a doctorate in their degree, as an athletic trainer is not a doctorate degree. Now we're a master's. An athletic trainer is actually out at a site doing a lot more of a little bit more encompassing stuff. Physical therapists don't usually do much taping, although some physical therapists do know how to, and they actually, a lot of people actually will do athletic training. It used to be that people did athletic training as their bachelor's degree and then went and did physical therapy school after that, and so they were both. And so they were able to actually be out at games, covering games. They were able to cover practices, taping, first aid, and all of that kind of stuff. Whereas a physical therapist is more in the clinic. They can also specialize as a physical therapist. Some specialize in pediatrics, some specialize in geriatrics, all depending on what their interest is. They can study a little bit more on that. Some of our physical therapists, even at Children's, specialize in like running, so they are better at gait analysis. Some specialize more in the throwing area, and so they can specialize a little bit more. As an athletic trainer, we're a little bit more generalized.
Great, thank you. I have a question for you. Can you tell us about one of the coolest experiences that you've had as an athletic trainer?
So I can tell you a little bit about the most coolest injury that I first anticipated or first got to experience when I was down at ESPN's Wide World of Sports. I was working a twirling competition. So yes, twirling, batons, like majorettes kind of stuff. For 3 days, we hadn't even given out a Band-Aid. And I was working, and all of a sudden, one of the spots went down, and everybody just started stopping around there. And I was so confused on what was going on. And I was like, oh, they'll call for a trainer if they need me. And all of a sudden they said, trainer. And I go over and I'm looking for a high school female, and I don't see one. I see a 40-year-old male on the ground. And I was like, sir, what's going on? He was like, I think I dislocated my knee. I was like, okay, like it's very difficult to dislocate your knee, but okay. Do you mind if I feel around? And I felt around and I saw, so we'll say that this is his thigh bone and this is his shin bone. They're normally like this. I felt them like this. So stacked next to each other. His knee was very wide. And then his kneecap was up here instead of covering where his knee should have been. And I said, sir, I think you dislocated your knee. Let me call my supervisor. And I called my supervisor, and she got the ambulance there very quickly. And we were able to take him away. But he was trying to coach the athletes and show them that he could do the routine just like they could. But unfortunately, he was not able to do the big team routine the next day. But that one will stick with me till the day I die, because it was a very interesting and unexpected injury that we would have dealt with. But some others that I would say are the most rewarding would be, I've got, you know, a girl that tore ACL in March of like a year and a half ago. And, you know, she really didn't want to wait a whole year to go back to basketball. But, you know, I said, if we work on this, we're going to get you back. And she is killing it on the basketball court. And to be able to have worked with her through her rehab and see her back on the court, I am thrilled to be able to watch. And that is the most rewarding part as an athletic trainer, is being able to see them go back onto the court and do like phenomenal, better than what they were before.
That's awesome. Well, thank you so much. We really appreciate you, Miss Dixon. This was a great presentation. Thank you so much. And that ends our day today. So we'll be back tomorrow.
Thank you, guys.
See ya. Thanks.